Hello guys, today we are going to discuss about a laboratory test called CSF analysis. CSF is cerebrospinal fluid, a colorless fluid which is present in our bone marrow and around the brain. Use of the test to diagnose a disease or conditions affecting the central nervous system, such as bleeding within the brain or skull, cancer, autoimmune disorder, or infection. Cerebrospinal fluid is a clear, watery liquid filtrate that is formed by the choroid plexus, a special tissue that has many blood vessels and lines the small spaces or chambers in the brain. CSF flows around the brain and spinal cord, surrounding and protecting them. CSF is continually produced, circulated, and then absorbed into the blood system. About 500 ml is produced each day. This rate of production means that all of the CSF is replaced every few hours. A protective blood-brain barrier separates the brain from circulating blood and regulates the distribution of the substances between the blood and the CSF. The barrier helps keep large molecules, toxins, and most blood cells away from the brain. Any condition that disrupts this protective barrier may result in a change in the normal level or type of a constituents of the CSF. Because CSF surrounds the brain and spinal cord, testing a sample of CSF can be very valuable in diagnosing a variety of diseases affecting the central nervous system. Although a sample of a CSF may be more difficult to obtain than, for example, urine or blood, the result may be reveal more directly the cause of brain-related symptoms. For example, infections and inflammation in the meninges or the brain can disrupt the blood-brain barrier and allow white and red blood cells an increased amount of a protein into the CSF. Meningitis and encephalitis can also lead to the production of antibodies. Immune disorders or diseases that affect the CNS, such as Guillain-Barré syndrome and multiple sclerosis, can also produce antibodies that can be found in the CSF. Cancers such as leukemia can lead to an increase in CSF white blood cells, and cancer tumors can result in the presence of abnormal cells. These challenges these changes from a normal CSF constituents make the examination of a cerebrospinal fluid valuable as a diagnostic tool. CSF analysis usually involves an initial basic set of a test performed when CSF analysis is requested. CSF color, clarity, and pressure during collection. CSF protein, CSF glucose, CSF cell count and differential. If infection is suspected, CSF gram stain and culture need to be done. A wide variety of other tests may be requested as follow-up depending on the result of the first set of tests. The specific tests that are requested may also depend on the signs and symptoms of the patient and the disease the doctor suspects is the cause. Each of these tests can be grouped according to the type of examination that is performed. Physical characteristics include measurement of the pressure during sample collection and the appearance of the CSF. Chemical test. This group refers to the test that detect or measure the chemical substances found in the spinal fluid. CSF is basically an ultrafiltrate of the blood. All of the large molecules, such as protein, are left in the blood and do not normally pass across into the CSF, so it can also be affected by what is going on in the blood. Normally, certain constituents of the CSF, such as the protein and glucose, are a percentage of the blood levels. So CSF levels are often evaluated in relation to the blood levels. Microscopic examination, cell count and differential count. Any cell that may be present are counted and identified by cell type under a microscope. Infectious disease test. Numerous tests can be performed to detect and identify microorganisms if an infection is suspected. Sample required cerebrospinal fluid or CSF. Normally, CSF color is colorless. CSF protein 15 to 60 milligram per deciliter. CSF glucose 50 to 80 milligram per deciliter. CSF cell count and differential. Normal cerebrospinal fluid in adult and children contains no more than 5 white blood cells. However, normal CSF of neonates contain an imperceptibly defined number of WBC, which may be as many as 15 to 30 cells per cubic millimeter. If infection is suspected, CSF gram stain and culture may be done. Generally, it is negative. That is about CSF.